Thanks for staying with us. I'm Janine Strafasi. We've all heard the expression, oh, my aching back. Well, in reality, more than 80% of all Americans will have back pain at some point in their lives. Some back pain is easily treatable, but for many, the condition requires the attention of a doctor. Joining us to talk about back pain is Dr. Charles Daknis of the Spine and Pain Centers of New Jersey and New York. And Dr. Daknis is an anesthesiologist. Thanks so much for being with us today.
It's a pleasure to be here.
Let's talk about some of the more common reasons for back pain. I don't know anyone who doesn't have back pain.
Sure, it's very common. One of the most common reasons people will miss days at work next to the common cold. Some of the more common things are really just being deconditioned. You know, Americans nowadays and people throughout the world are quickly catching up to us and having a very passive lifestyle. You know, we're not out plowing the fields, we're not out carrying a lot of weight and doing things, and we tend to get a little soft sometimes, especially our core musculature, abdominal muscles, or our legs, or low back muscles, and they don't support the spine so well. And then we decide we're going to go out and do something athletic on a weekend, and we injure ourselves.
Especially even like during these winter months with shoveling the snow. I mean, that's one of the biggest things, right?
Without a doubt, yeah, something like that. It's a very mechanical, a very heavy type of activity, and people who aren't used to it really have to exercise a lot of caution.
Right, so exercise and of course our obesity epidemic, especially here in New Jersey, that's got to play a huge factor.
You know, that's a sort of a worldwide event at this juncture,
sure.
But, especially in the United States, it's a real problem.
All right, so how do we know, doctor, then when it's time to go to a doctor? I mean, when do we stop popping the Advil and start, you know, making an appointment?
Well, the good news is that 80% of all of the acute back pain will resolve on its own with Advil, Tylenol, rest, a little bit of ice to the back. But when the pain starts to persist, say more than 2 or 3 weeks even, then it's about time to get in there and have your primary care physician take a look at you and make sure that there's nothing else going on.
So what are those other things that could be going on? What are some of the more serious things that people could be experiencing?
Well, you know, one of the things everybody thinks about, oh, I've ruptured a disc in the back, you know, I've got a slip disc. And that's one of the most common things that we do see after this whole muscular issue. But sprained muscle, ruptured disc, arthritis in the back can cause problems with significant, persistent low back pain. You know, even the more esoteric things like infection and you know, a person may have other medical problems. Those can be real issues.
Now, I know being a mom of a 2.5-year-old, I mean, mothers lifting their kids up, I mean, it really has to do with a lot of how you're lifting things, right,
Sure.
too?
Absolutely. And see, in that situation, that's more muscular. And that's one of the most common things.
Yeah.
Individual doesn't really, you know, lift the weight properly, or the child properly, or the twisting, and kids tend to wiggle.
Right,
so,
exactly.
you know, maybe they may throw off the mother's balance, and she'll strain a muscle.
Yeah.
And fortunately, that will heal most of the time on its own, sometimes with a little bit of exercise or anti-inflammatory.
Okay, so there's different ways of treating back pain. You deal with pain management, which is basically very commonly giving people shots in their lower back. Is that correct?
Correct, yeah. Well, neck, back, thoracic spine.
Okay.
And there are other aspects to it as well, but specifically with respect to back pain today, you might see somebody like myself after you've gone to your primary care physician and they maybe have treated you with physical therapy or they treated you with medications and you're still not getting better.
So we're talking what, cortisone shots?
Perhaps, yeah. Cortisone shots can be used. Nobody usually uses cortisone per se. It's a you know, second, third generation steroid at this point. Very low side effects.
Steroidal type
steroidal
shots.
injections, yeah, can be very helpful.
And that'll what, numb the area for you?
What it does is it actually relieves the inflammation, the swelling, the damage to the affected area, so that the person can rehabilitate at that point. Once again, back to the exercise.
Now, what about chiropractors? When should a person see a chiropractor?
Chiropractors can be extremely helpful in helping with that muscular reaction to the acute inflammation. So when your disc herniates, your muscles clamp down to support that area, and your chiropractor can help to relieve the amount of spasm around that area, make you feel better.
And you know, it is the holiday season, and I think stress often has a lot to do with pain and dealing with it. So how much does stress play a role in all this?
A huge factor, absolutely huge. You know, when your brain is occupied by 50 billion different things, it doesn't process those signals so well, it doesn't filter out that pain signal so well, and it becomes overwhelming for individuals. So stress plays a huge factor. You have to take some time for yourself, do some relaxation, do something you enjoy, so you're not frazzled.
Yeah, and lastly, overall, just take us through, what do you think people should do? So if you have back pain, first try to manage it on your own if you can. If not,
yeah, I think that, you know, you can try the over-the-counter remedies, ice, rest, but if it's not improving after, you know, a week or two, definitely want to contact your primary care physician, have him or her take a look at you, maybe x-rays, maybe even an MRI, and they'll do a physical examination and find out whether there's any neurologic issues, and it will progress from that point forward. But I think that's your primary contact
It's a process of elimination, I guess, a lot of times.
You have to make a diagnosis and treat that diagnosis.
Sure. All right, thank you so much. It's great information.